Greetings, everyone, and welcome to the MWR seminar series, where today we will be discussing science and health, some basic science and health, along with some basic health-based tools for everyday life. And we'll discuss that today. My name is Graziano. I'm an employee and trainer here at the Navy MWR Fitness Center. I'm proud to and excited to come to you and discuss the aerobic system along with maximum aerobic functioning with you today. And as part of the MWR seminar series, we're discussing energy systems, okay? So of the many things that we could be discussing, literally hundreds of topics, I did feel that energy systems would be a good one to start off with, at least just providing the basic outline for everyday people to understand them, so that when we're finished with this presentation, and by the end of this, you will be able to understand a lot more on how they both work. But for today's purposes, I'm going to focus on the aerobic system, and more specifically, maximal aerobic functioning and exactly what that is. So one thing that I want to point out as I get into it is that I have made a very strong attempt to try to really dial it back to keep it very basic and very simple. I will move through these slides quickly, but effectively and very straightforward. But at the same time, there's a lot of things here that, of course, we could drill further down and deeper into. But for today's discussion, only just wanted to focus on aerobic functioning, some of the benefits, the reasons why it's important, and at the end of the day, give you some information that would be very helpful. Now, by no means am I a medical doctor, so I want to emphasize right away that this is for educational purposes only, in the spirit of bringing our patrons at the MWR free and no cost additional information. And last thing, your health is personal, so this is up to you. So what I provide here is just for your education. By no way is this mean to diagnose anything. So again, taking everything that I'm putting here, just taking it from a personal standpoint. You could be coming off of an injury. You could be just starting your fitness journey. My hope is that this material here just gives you a guidance to allow for your fitness adventures to be more fun, to be more productive, and ultimately enhance your knowledge. So without further ado, let's get into the program here, where I'm going to introduce to you maximal aerobic function and the importance of your aerobic system and developing that system. Okay, so in the agenda today, I'm going to talk about maximal aerobic functioning. We're going to discuss exercise intensity versus inactivity. We're going to understand basic aerobic and anaerobic functions. Then we're going to look at heart rate, how it's relative to training using maximal aerobic functioning, which we'll get into through these slides. And then I'm going to show you a formula that you can use to calculate your individual maximal aerobic function heart rate, which can be used as a guideline for future trainings. And then I'm going to teach you at the very end how to conduct a math test, maximal aerobic function test. And we'll give you some examples of some different types of athletes, as you will see. So to start off, just want to touch on the health consequences of overtraining syndrome. So why did I choose this topic? The reason why I chose this topic was because I believe that we are in an epidemic right now of just overtraining, overworking, chronic stress. And so as we move through our days in this environment of chronic stress, many people really try to get that release at the end of the day and come to the gym and then pile on a real heavy or hard set or go for a real hard long run. And in the process of doing so, maybe exacerbating the stressful symptoms that they're experiencing throughout the day. So in other words, a full day of chronic stress followed by a short hour or so or 90 minutes of an extreme exercising with the hopes of the more pain, more gain, but that doesn't always work. So what we're finding, what I'm seeing is a lot of overtraining in folks. And so the first slide is just to really help you understand, like, what is overtraining? How can I tell if I'm overtraining? And what are the consequences? So this can happen from anybody. I mean, but what you'll see is muscular injuries, decreased immunity. You'll see hormone imbalances. You'll see sleep disturbances and so on. And so for this reason, maximal aerobic functioning will be introduced to help to, first of all and foremost, avoid some of these symptoms and avoid overtraining altogether. Now, the things that you look for are all here. I mean, these are just a few: loss of performance, soreness, appetite, fatigue, poor sleep and insomnia, decreased libido, restless leg syndrome, these types of things. These are all types of early indicators that you could be overtraining. And so how do I know? Well, one way is to take a resting heart rate. And so what I'd like for everyone to do at some point is, or I'll ask you, challenge you, just wake up, wear a heart rate monitor, you need it. And when you wake up in the morning, for the first moment, just take a look at what your heart rate is, just laying down. Do that 3 nights in a row, take the average, that's your resting heart rate. Once your resting heart rate starts to climb up, if you're experiencing anything 5 to 6 to 8 beats higher than what you've established, then you know, usually that's a sign of overtraining. So, you know, overtraining can be good. We want to introduce stress to the body in levels that it can handle, adapt, and then recover from to be stronger. However, too much of that will obviously cause problems. So what I've shown here is kind of a curve, right? So where we would like to be, you know, as a coach or somebody who's actually training someone, would be helping them to stay right in this productive zone here. You can see in the middle of that line, there is a red bracket. So you can see as performance increases, you reach an overreaching state. There's a sweet spot for training, which is right there where that middle dotted line is. And then as you continue to press past the issue, you go into overreaching and overtraining. And the goal of this, one of the goals of this speech, is to actually help you to recognize how not to go into overtraining mode so that you can maximize your training and avoid injury and really just be more consistent and find fitness to improve over time. So as we know, anything high intensity, we increase the risk of injury. On average, 50% of Ironman athletes suffered either an overuse injury or an illness while training for their races, and that's just more than half. You can look at CrossFit. You know, a lot of injury rates very high. You know, several years ago, we're talking about close to 73% injury rate with high intensity training. So with the high injury rates associated with high intensity training, we're not demonizing high intensity training. There's a place for it and it's very effective. But for the average everyday person looking to get their fitness in control and looking to reach goals and have longevity and durability, we need to just assess the amount of high intensity training that we're doing and perhaps reduce that, incorporate more aerobic training to avoid injuries. So now as we go forward, we're comparing the aerobic systems, right? We have what's 2 main systems. Now I will say these are 2 separate topics. We could talk for hours on these, but for aerobic and anaerobic, these are the 2 primary driving systems. Now, I will also say, without getting too deep into it, during either one of these times, both systems are somewhat engaged. But for the purposes of today, I want to focus on aerobic exercise and the characteristics associated with aerobic exercise and how they can be beneficial for you. But let's not forget what anaerobic exercise is. So comparing the 2, aerobic is basically an oxidative system. So it relies on aerobic system, which includes moderate continuous activities, long distance jogging, speed walking, the type of activity where you can actually hold a conversation with someone without being out of breath. That's typically what you call aerobic. On the contrast, our anaerobic is a different energy system. It's the ATP-PC system, which we'll hold for another discussion, which is very short and intense. These are your sprints. These are fast bursts. These really outpace the body's oxygen delivery. So you'll notice that you may receive lactic acid, the type of burning in the legs. This is characteristics of anaerobic, okay? So the 2 very different systems, and we're going to focus here on the aerobic aspect. Now, here's just a graphic that I wanted to show. This is just showing us as we move into discussions in the next couple slides, transition into looking at math formula and maximum aerobic functioning. Again, it's important to have a little bit of front knowledge on training thresholds and their work intensity and the zones that we're going to be talking about as far as where our heartbeat's going. So for the first of 3 here, you can see anaerobic or aerobic threshold, I apologize. You can see that where this little red bracket is here, This is the zone or the area or the intensity that the maximum aerobic functioning training will take place in. So in other words, this is low intensity, primarily fat metabolizing, and aerobic. As you move up the curve, you'll move into, as you start to go into slightly higher intensity exercises, you'll move into the moderate to high intensity zone, and then ultimately into high intensity, which is on the right side of this graph, which is using primarily sugar for metabolism. This is your anaerobic. This is your short, powerful sprints. These are the differences here. And for today, we're focusing again on looking at the aerobic aspect. So what is anaerobic exercise? So we're going to talk very briefly on this. Anaerobic means without air, without oxygen. That uses, again, the ATP PC system, which is known as the anaerobic alactic system. Again, for another discussion, just laying the groundwork down, understanding aerobic, anaerobic. Now, the ATP PC system, or the high-intensity anaerobic system, it used during high-intensity exercises, once again, short durations. Think sprints, think powerful jumps. It uses creatine phosphate as a fuel to produce ATP through chemical reactions. So it's a separate way of generating your energy. Its anaerobic exercise is always high intensity effort performed over short periods of time. Okay, so this is greater than usually 75% of your maximum heart rate is where you actually convert from aerobic, hard aerobic to anaerobic. Okay, so again, just a little bit of foreknowledge on this. Some examples, again, sprinting, hill climbing, maximal effort intervals, Tabata, powerlifting. The benefits are there. I'm not here to demonize it. There are many benefits. You can develop strength and power, increases your VO2 max. It utilizes muscle and glycogen stores in the body, and it just increases your peak performance. Now, on the other side of the coin, we have the aerobic system. So this is the system that is in charge of your body, right? Which is not in charge of you, but it's taking control of the systems during exercise that you can use when you're going for a long, slow duration of time, right? So this is the long, low intensity exercise. It uses oxygen to produce energy. And it does it, this is key, by converting glycogen into glucose. Okay, this efficiently burns fat for fuel and improves health, longevity, recovery, and endurance. So the aerobic oxidative system is slow and long. It uses oxygen, okay, primarily to convert glycogen into glucose, and it effectively burns fat as your fuel. Okay, so there's the difference there, whereas your anaerobic system is using primarily sugar and glucose, your aerobic system relies on fats for energy. So when oxygen is available, the intensity of the exercise is usually lower, okay? The best aerobic training, and I'll say this, should be fun for you. It should be something that you enjoy doing and something that you can sustain over a longer period of time, okay? What is aerobic exercise? Once again, aerobic oxidative system, it's used during low intensity exercises for longer durations. This is completely different. And what we're going to talk about in the next coming slides is how can you improve that system, doing what to make this system more efficient. All right, so again, focusing on the aerobic system, this is the system that you'll use for exercise durations greater than 90 seconds. It uses oxygen to produce energy, again, by converting glycogen to glucose. Now, with oxygen means that there's a breathing element involved, so it's under control. Again, you'll know you're aerobic if you're able to perform your exercise with a conversation pace. Again, you will most likely have a more welcoming experience with your cardio if you can learn to run and dial it back. But again, this is something that we're going to introduce. So again, 70% of max heart rate. Okay, so aerobic exercise is under 70%. So it's like less than 70% of your maximum heart rate. And this is known as zone 2 training. We've heard about this. It's substantially lower. It's going to create a lot of physiological adaptations. It's going to be fantastic for you. What are the benefits of aerobic exercise? You've got a ton of them. Okay, lower blood pressure, increased metabolism, increased mitochondria, red blood cell, left ventricular fill, stroke volume, lots of cardiovascular benefits. And now, what is maximum aerobic function? Okay, and so how do we tie this all together now? So in order to reach a maximum aerobic function, you have to understand first the differences between aerobic and anaerobic. Second of all, the systems and how they rely on our bodies to create energy and how their fuel is created. Okay, and then we also have to know at which heart rate, okay, that we are going to establish our body in order to benefit the most. So this is also known as the MAF method. Again, maximum aerobic function. It's created by Phil Maffetone. It's a heart rate training method that focuses on keeping you in your aerobic zone for the duration of your exercise for a period of time. Okay, so the way we find this out is basically by taking 180 minus your age, and we'll get into that. So energy system summary. So again, now that we have a little background on what is the aerobic system, we have a little understanding of what is the anaerobic system. Here is a chart that gives us a breakdown of the energy system and the type of activity that powers it. Don't pay too much attention to number of ATP produced. Again, ATP would be for another discussion, but if you look at the energy system, you can see at the bottom here, the oxidative phosphorylation, that's aerobic. Again, the type of activity is powered primarily from fat, and it's low to moderate intensity, long duration. On the contrast, at the very top here, you see the ATP-PC. That is a very high intensity, short duration, 6 to 10 seconds without oxygen. So again, we are focused on this, developing this specific energy system, singling it out and really bulking it up. So that energy system needs to be built up. We can only do it by understanding where our heart rate is objectively. So we do it by understanding heart rate zones. This here breaks down the 5 major zones, okay? And as you can see here, zone 1 and zone 2 account for your aerobic zone. So when you're training to get the most benefit out of your cardiovascular training aerobically, you want to be able to train for durations under between 60 to 72% of your max heart rate, right? Once we break into, over 83% of max heart rate, now again, we're using a different energy system. We need to make some changes. Okay, maximum aerobic function. Okay, what that is, it's a well-functioning aerobic system. Okay, we're going to rely on fat as fuel instead of carb as fuel. We're going to find increased energy and endurance. We're going to be able to run longer and faster, disease prevention, cognitive function, and overall health benefits. So the MAF is unique in the sense that it assesses and intervenes in the aerobic system to reduce the risk of poor health and chronic disease while simultaneously expanding a person's athletic potential. So what this means is basically what you're doing is you're increasing your athletic potential, you're increasing your cardiovascular system benefit, and at the same time, you're reducing the risk of poor health outcome. So by training this, essentially it means is you'll get better and you'll get fitter. Okay, so focusing on aerobic function definitely has its benefits, and athletic or fitness dysfunctions such as recurring injuries, lack of improvement, overtraining syndrome, burnout syndrome, this can all be traced back to training at an intensity that's too high for too long. So again, the key to longevity here is understanding how to dial it in aerobically. Now, why is MAF unique? Well, MAF is unique because it really focuses on building your fat burning engine, okay, by training at a low intensity heart rate that's specific for you. It prevents injury by putting your health first. It debunks the whole philosophy of no pain, no gain, and it considers any physical, biomechanical, biochemical, or mental or emotional stress that you may be going through. So the low intensity exercise doesn't really compound the stress responses that you may be receiving if you're under a lot of stress from work. And also math is open system that can be used alone or alongside alternative fitness methods. Now, it's the only system I use. I've been using it now for about 15 years and it works fantastically. There are some pros and cons with both. Using maximum function training, as we'll get more specifically into, it will improve fat burning, right? You become fat adapted a little more as you learn to improve your fat burning. Your fitness base will improve, your lung function, mitochondria will improve, and then you will notice some weight loss with consistent training sessions using maximum aerobic function. And then the cons, I mean, like, to be honest, it's slower than you're typically used to. So it takes a little bit of getting used to. It might be difficult for newbies to keep their heart rate so low. You might think, I'm not getting anything out of this, I'm not working hard enough, but quite the opposite is actually happening. It can be boring. If you're in a speed phase right now, or if you're a high intensity track athlete, you wouldn't want to do this type of training because it is speed deficient. And that there's psychological effects that you know may make you feel as though you're not actually challenging your body when you are. Now, the approach to math is basically very simple. What you do is you take 180 minus your age, okay, and then you use some other characteristics and some guidelines, which we'll go over, to come up with a heart rate formula. Okay, once you do that, then you're going to basically do a simple math test. Could be a 2-mile walk, could be a 3-mile walk. You can pick the distance. I recommend 2 to 3 mile walk or jog, and then you compare the difference over time. So a key point here is that, you know, when we're using math, okay, we need to establish some equipment. So we need a heart rate monitor. And why? Because we're getting objective feedback. We know at real time exactly what our body is doing under the conditions we're giving it. So if we're on a treadmill and we're on an incline, our heart rate's higher. We bring that down. Simply by bringing the incline down, our heart rate should drop. Not only should we feel it, but when we look at our watch, we should see it. So by using a heart rate monitor, we can really aid in exercising at low level of intensity because we can see the intensity that we're training at. So during this time, and only this time, the body will secrete certain hormones that are necessary for your aerobic function and fat burning. So even if you think you're going slow, unless you know objectively, it's really hard to tell. So that's one piece of equipment that we really need to have while we go, is being able to measure our heart rate. Now, what is the math formula? Basically, it's 180 minus your age. That's it. 180 minus your age gives you your maximum aerobic heart rate. So anything over that number is now outside of your aerobic, okay? And then going into now anaerobic. So how do we determine maximum heart rate? So here are the key guidelines right here, okay? So the first thing we do is we subtract our age from 180, and then we modify based on the categories below. So you'll see the first one would be if you've been training consistently at least 4 times a week for up to 2 years without any problems, no modification is necessary. Just use 180 minus your age. The second condition would be if you have been training for more than 2 years without any of the problems above and have made progress in your math tests, you're improving competitively and without injury, you add 5. So this would be for someone who's a competitive runner. This could be, Olympic athlete. This could be for someone who's been training for a period of time. Whereas the one right above it is someone who's just, not quite as far along the and haven't quite hit the 2-year consistent mark. The third would be over 65 years of age. We just add 10 beats. Okay, and then fourth and fifth, they kind of consider any sort of illnesses, rehabilitation and medication, whereas the fifth one looks at injuries, as well as the type of body mass index you're dealing with, or if you're been inconsistent. So depending on where you fall with these categories will determine your final math heart rate. Now, what is the math test? So once we decide your math heart rate, then the next step is to go out and take a math test. And so what we do is obtain your maximum aerobic heart rate using the 180 minus age formula. Consider the characteristics from that previous slide, make that calculation. Then While keeping that target heart rate, you establish your running, walking, or jogging pace over a certain distance in minutes per mile, and make note of it. So a very simple thing would be to do a 2-mile walk, looking at your heart rate, keeping it aerobic, keeping it within that 180 minus age range, and then taking a note of how long it took you to take that 2-minute walk. And then we repeat that test in 3 to 4 week intervals. Okay. Now, during that test, your time should get slower with successive repetitions. So if your first mile is, a 10-minute mile and your second mile is a 12-minute mile, that's normal. And then during the repeat math tests, indications of faster times come as training goes on, indicating that you're able to do more work with the same effort. So here's an example of a math test that I've done. I pulled it out with someone that I had worked with recently. And what we've done was we established the baseline in September, where their first mile was 16 minutes and 32 seconds. Their second mile was 16:46, and their third was 17:49. And as you can see, each month that we repeated the math test, we see decreases in the amount of time it takes them to complete that duration or that distance. So by the end of, by December, they had dropped, for the first mile, 1 minute and 22 seconds, the second mile, 1 minute and 24 seconds. And then interestingly, which is really interesting, the third mile was actually the most time dropped, was 1 minute and 38 seconds, which tells you as the distance and duration go on longer, the benefits of this type of training increased. So over the course of 3 miles, this individual improved almost 5 minutes just through training through maximum aerobic functioning. That doesn't even include speed work, okay? So here would be an example 1, okay? So let's just go through a couple examples to finish up. We have a 27-year-old triathlete who has competed competitively as an amateur for the past 2 years. They're going pro. Typical training week consists of 5 days of cardio-focused training, no history of injury, and is making progress in math tests. Going back to the type of characteristics we look at when considerations, we're going to take 180 minus the age, come up to 153. And because they've been going over 2 years, they're making progress, they have no injuries. We're going to add 5. So 158 beats per minute for a 27-year-old triathlete is the ceiling. So this is the established math number that we would have for them, where they would be conducting all, if not all, of their training during their base building phase. Finding the math heart rate for a 48-year-old physical therapist who's been active for at least 4 days a week for the past 20 months, primarily weekend warrior, no history of injury, and is making progress. Now, the only thing here that's separating from the first example is that they haven't been going for 2 years. So we're just going to take the 180 minus their age, and we're going to come up with that perfect number of 132 beats per minute for their ceiling maximal aerobic functioning heart rate. Number 3, we have a 7-year-old former tennis player who is active and generally in healthy shape with no underlying conditions. He's completed rehab surgery and has been cleared to exercise. What we do is we take the math formula, 180 minus age, we add 10 because this individual is over 65, and we have their math heart rate of 120 beats per minute. This individual will train at this beats per minute maximum. And finally, number 4, we have a 49-year-old nurse anesthetist who has a history of heart disease and is taking medication. Basically, she's decided that it's time to restart her fitness journey after several years layoff. Okay, but what we're going to do is we're going to take her age minus 180. We're going to come with that 131. And then because they're taking medication and there's anxiety and, we're looking at a couple, kind of like risk factors here. We're going to minus 10 in this case, adjust that heart rate to give her a little bit more a little bit more margin to give her a math heart rate of 121 beats per minute. So in conclusion, the Maffetone method emphasizes the importance of building a strong aerobic base. It may not be the best approach for everybody because everyone may be working on different goals. But for the weekend warrior, for the average person looking to improve their fitness, for the person looking to increase their longevity, the Maffetone method is definitely one to consider. Now, some people may benefit more from other types of training, but again, it's just depending on where you are right now in your fitness goals. But the majority of folks that are training at intensities that are counterproductive to their aerobic development, and consequently, they're inadvertently creating more stress. Guys, let's not be that person. Let's take it day by day. Let's go for consistency. Let's learn the math formula. So the math heart rate guidelines are the gold standard for longevity, okay? Recovery, physiological adaptations related to fitness, training, wellness, and endurance, guys. This is highly individualized and proven beneficial across vast demographics. It's a very simple way to come up with an objective measure that you can stick to make sure that you're getting the most benefit from your aerobic exercises, at least the time that you're spending in the gym. And with that said, I thank you for joining. I will wrap this up. I tried to cover as much as I could, as quickly as I could. All the references are here listed that I've used. If you have any questions, please leave them in the comment. If anyone's interested in learning more about this, please let me know. If you'd like any information on this specifically, or would like some help coming up with a math heart rate formula, stop in and let me know. We really appreciate you. Thank you for your time. I hope you guys have a good rest of your day.